YouTubers, subscribers, followers, and viewers, thank you so much for clicking on this video. I'm so glad you did. If you're new here, I feel I'm obligated to tell you that I was on a recent episode of Dr. Phil featuring cryptic pregnancy, extended gestational pregnancy of 2 to 7 years. I was on this episode because I experienced a false cryptic pregnancy, and the reason why I call it a false cryptic pregnancy is because I thought I was cryptically pregnant for 5 months. It turned out that I was not pregnant and that I had in fact experienced a phantom pregnancy. Now, I didn't come to realize I experienced a phantom pregnancy until several weeks later, at least 3 to 4, almost 5 weeks later. It took a lot of research for me to get there. Anyways, so I was on this recent episode of Dr. Phil, and I feel it's highly anticipated, my thoughts about this specific episode, how I feel it went, and then I want to talk about thoughts of people's reaction to me in my most recent video, where I talk about I was on Dr. Phil cryptic pregnancy, as well as 3 important points that Dr. Phil left out of the episode that I think were very important, but I understand why we weren't able to cover them because of time. So let's start out with my thoughts on the Dr. Phil cryptic pregnancy episode. I do have a few notes here in case you see me looking down. That's what I'm looking at. So 1 second, let me check on my boys. Okay, they've literally been in there for 2 minutes by themselves, and just gotta check them because they're boys. So my personal thoughts on the Dr. Phil cryptic pregnancy episode are that he asked very good, important, relevant questions. There's been some speculation about how he worded these questions or the way he lined them up. But honestly, I completely understand. Like, it's very hard, for him to stand on the side of possibly believing that they are years pregnant is a little bit harder because of textbooks and things like that. He would be going against them. Yes, I do agree there. However, hold on. So I guess what I'm trying to say is it's harder for him to be kind of neutral about the topic because he knows all of the research that backs up a 9 to 10 month pregnancy. But I'll go a little bit more into detail about when I talk about the things that he left out of the episode that I think are important. Also, I think it was very, very good and positive that both of these women left with an alternative diagnosis to their symptoms. Whether they were aware of it prior to the episode or not, it's still something that is relevant. If they have these diagnoses or these possible diagnoses that they haven't, followed through with treatment, it is possible that these are causing them their symptoms, these conditions. So also, I think what was very good is that Dr. Phil offered these women additional help. He asked them, whatever test they want, whatever test they think would help them, except that they're not pregnant. He offered them these things for free, which I think is very, very good, especially, I would have took that up immediately when I thought I was cryptically pregnant, mostly because I didn't have insurance at the time. And so, yeah, I would have definitely took up that additional help. So those are my, those are kind of my thoughts about the Dr. Phil episode. I honestly, I didn't like the date that they chose for this episode, airing it on Halloween. And then it was brought to my attention that there was some controversy that happened like either like a few days, like a day or days before the Cryptic Pregnancy episode aired. And so I think that kind of changed people's view of what they were seeing. There's been a lot of talk about, you know, where did they find these women? How do they, like, you know, how much did they pay them? And it's like, you know, we're real women. I'm a real person. I was not paid to do this. I wanted to share my experience. So yeah. But yeah, I mean, I don't want to go into, you know, I like I said, I think the questions were good. What the intentions were behind them, I don't know, because I'm not Dr. Phil. You know, I know how I word my questions. I know how I talk to these women personally. You know, put the accusations aside. If you read my comments, and I do try my best, even when they're being rude and disrespectful and calling names, I do try my best to not react to those things and instead focus on just trying to help, just trying to be there. You can hate me, you can love me. If, you know, you can hate me for however long you want. I'm still going to be here for you in the end. So, I also wanted to talk about my reaction to the video that I made titled, I Was on Dr. Phil, Cryptic Pregnancy. And all I have to say is that, you know, there's some of the comments that I've been getting on that video are unempathetic, they're presumptuous, they're straight up mean. Sometimes people can just be mean, and that's okay. It's making me stronger. So, and then I wanted to talk about the 3 important points that I think Dr. Phil didn't mention on this episode that I think would have changed a lot of people's opinion about why these women believe that they are years pregnant, like truly and honestly, because he left out very important points. And I think if he would have mentioned these things, a lot of people would have changed their opinion. And they might have, and it might be taken a lot more seriously than I think it is, which I was hoping that would be taken more seriously, just because I want somebody to look at this seriously. I want somebody other than me, somebody that, like, I want a real doctor or a real scientist, anybody to just look at this and maybe even help make a new name for a 2 to 7 year cryptic pregnancy. And that's usually what I call it, is a 2 to 7 year cryptic pregnancy. And then I call a real cryptic pregnancy, a real cryptic pregnancy, and then 2 to 7 year cryptic pregnancy. That's how I try to differentiate. I've come up with a lot of different terms over the last years to kind of explain this besides the term cryptic pregnancy, because it is so confusing. And you know, Dr. Phil makes this point, and I think it is important that it is a term that's already been taken. It already has a medical definition. But I went off on a whole nother topic. Let's go with my 3 important points that I think Dr. Phil didn't mention that I think would have changed things. The fact that not most. Retract that. The fact that some women, and it's not like a small amount, it's common for women to not test positive immediately, you know, in their pregnancy. So there's some women who don't find out they're pregnant until they're 7 weeks, 8 weeks, 9 weeks, 10 weeks, and on, because the pregnancy test won't, it just shows negative because there's no HCG in their system. 1 second, my son is sticking his arm in the door. Hold on. So I really think that if this was mentioned in the episode, that there are women who pretty much go all the way up into their due date, not testing positive in urine, and possibly not testing positive in blood, but definitely not testing positive in urine. And so if these women automatically know that they are pregnant, then it's a little bit of a different road, and that's why a real cryptic pregnancy can happen, is because they either test too early or they don't have HCG in their system, which I think should be looked at. And I, you know, through all of the YouTube videos that I've watched with people documenting their pregnancies, I mean, because this is like firsthand experience. So, 1 second. Also, I think he failed to mention that there has been recorded pregnancies that have lasted 12 months. It's very, very rare, but it has happened. And so, you know, that is another reason why these women have their belief, is because of things like this. And then I wanted to mention that these women, you know, they use their Doppler, and this is why they adamantly believe that they are in fact pregnant, is because they're picking up heart tones, or they're picking up a fetal heartbeat, or what they've interpreted as a fetal heartbeat. Whether it's an actual fetal heartbeat is verifiable. Sorry. Whether every single woman in the cryptic pregnancy community who has picked up a fetal heartbeat, whether or not it actually is a fetal heartbeat, is up for debate, because you have to, you have to actively count these things. You have to do a wrist, and then try like how many beats per minute is this compared to what I'm picking up. Sorry, my throat keeps 1 second. Anyway, so these women are finding what they themselves are interpreting as a fetal heartbeat. Some even have shared them with midwives, and midwives have agreed that it sounds like a fetus. You know, and then you go to replicate it, and you're not able to find it, or it's not the same, or it's moved, or it's different. Anyways, I think it's also important to note that a Doppler uses the same exact technology as an ultrasound. So the fact that these cryptically pregnant women, you pretty much think a Doppler is the ultimate way of confirming a pregnancy versus an ultrasound, when they are the same exact technology, is a little bit convoluted. So, I'm sure Mom, see this? 1 second. So to me, it makes no sense to believe, this technology over this technology when technically they're the same technology. So yeah, I think that Dr. Phil should have made that point to these women, because they kept bringing up their Doppler. They kept saying, like, well, one of them specifically kept saying, this one's this many compared to, And the point is, it's the same technology. It's just different levels of it. It being lesser or more, like, why would you believe the lesser over the more? I don't know. But yeah, I think this is it for this video. I hope you enjoyed some of these points that I've made. I hope if you have an opinion about this episode, go ahead and leave them in the comments below. I would love to read your view and or laugh at it. I hope you are well. I hope you're healthy. I hope you learned something if you did watch the Dr. Phil episode. So yeah. Stay blessed, friends. Bye.